Medicare Open Enrollment Period is the time frame during which people with Medicare can make changes to their Medicare plans. This year, it will take place from October 15th through December 7th, 2012. Here to explain what we need to know is Johanna Giordano with WellCare. Thank you for being here.
Thank you, Jeff. It's a pleasure to be here.
Well, thank you for everything y'all do, and we just appreciate our relationship, and want to make sure everybody's clear on those dates in case they see this on YouTube or something at a later time. That's October 15th through December 7th. Is that correct?
That's correct.
Okay, well, tell us a little bit about what is Medicare Open Enrollment Period. I talked about plans and stuff, but I really don't understand. What is this?
This is a time when Medicare eligibles, commonly referred to as seniors, will decide if the plan that they're with currently is going to be the right plan for them going forward for 2013. This is an opportunity to look at the formulary, look at the provider network, and look at the benefits offering for next year to be certain that everything that you think you've been enjoying this year will still be available next year. If your medications are still going to be on the formulary, if something that you're taking, like a Lipitor, for example, might be available as a generic, and you won't see it as Lipitor any longer on your formulary. So those are the things that you want to look at, and make sure that you're taking the time to look through things like that, so that come next year in January on the 1st, when you're locked into this plan again, that you're happy with that decision.
So basically, they need to look at their existing plan and see if that provider is making any changes.
Correct.
And then also consider any changes in their life or their health and match the two up, so to speak, to make sure that what was the good thing to do last year is still the good thing to do based on the plan and their needs.
Correct.
Would that be correct? What are some common questions? I know you talk to a lot of people. What do people ask you?
Where can we go for help? You know, somebody help me sort through this because I really don't understand it. And I think many seniors are leaving things as they are just because it's the default thing to do and it's the easiest option. But truly, the websites on the plan that you're currently on, their websites, the plan sends you information as far as formulary and provider directory and benefits, so that you can get a family member possibly to help you if it's a little bit more than you can handle on your own. You can go to the library, you can go to the pharmacy, and they will be able to help you go to a website where they'll plug in your prescriptions for you, and that'll tell you whether or not those prescriptions will be offered by your plan next year, and whether or not there are any other options for you. Price-wise might be a consideration. So if 3 or 4 plans have your prescriptions next year, and the co-pays are going to be relatively low for you, then you might want to choose one that has a lower premium at that time.
Well, that's a good point to make, because a lot of people have that personal relationship with the pharmacist, and they may feel comfortable asking that person for help. But we'll be showing the 800 number for Medicare throughout this segment, as well as we have a graphic, which will also give that information. So this is for people who are already in it. What about people that are approaching that age? This is not for them. This is just for people making changes. Is that correct? It's
geared for people that are making changes. And if you are not currently receiving a Part D benefit, say you've been eligible and you were not participating with a Part D plan until this year, when you started to think, well, I'm starting to have an illness and I'm going to need medication, now's the time to go ahead and select a Part D plan. Other times of the year, you wouldn't be able to do that if you were already eligible and had delayed enrolling in Part D. So this is a time to make changes and also to add to if need be.
Well, I know this is fall and winter of 2012 we're talking about, but when do these changes go into effect as far as benefits and being able to use that plan?
The Open Enrollment Period benefit changes or additions that you make will be effective on January 1, 2013. At that point, you'll be locked in to your plan for the rest of 2013. There are some deviations from that, or caveats. If you're on a Medicare Advantage plan, you'll have until February 14th to go back to original Medicare. So there are a few opportunities to change, but most of the population will be locked in at that point in time. Now, if someone has help assistance, extra help, or low-income help, they can make changes anytime during the year.
Okay.
So they have an opportunity to hear about the new plans as well, but they can change now or they can change later whenever they decide to do that, if they decide.
You mentioned something interesting I want to go back to. So providers are sending information by mail stating their changes. So
Yes.
people should be on the lookout for some type of letter or documentation from their provider.
That's correct. The provider, meaning their plan, and they'll have the opportunity to review a formulary, a provider directory with the number of doctors that will be accepting the plan, and the plan benefits for the new year.
Okay. What if that match still exists, the plan in their life? You know, that's a good way to stay. How can they do that? Do they have to, and do they need to tell someone that?
No. The fact is that if you are comfortable with the plan that you're on now and you checked it out and you know that your medication is still available next year, the price is okay with you, you don't have to do anything. You'll be automatically kept on the plan that you're on unless you initiate something that will tell your plan that you'd like to change. If not, you'll just start 2013 with the plan that you currently have.
Okay. What about people who may be helping their parents or a neighbor or friend at church, whatever? What do they need to be careful about, I guess?
Well, I think that the help that that a senior citizen can get from a son or daughter or a friend is invaluable, because there's a lot of information, and you want to look out for things like any kind of high-pressure sales from another company. But you're going to be getting lots and lots of things in the mail, and you may feel completely overwhelmed, and that's the time when it's good to have your daughter or son come in or someone like that and say, okay, this plan isn't for you. You really don't need this. This is the plan we have, and we've been using this plan. As long as we're comfortable, we'll continue to use that plan. However, when there's a fit that's not quite working any longer, then we'll look at some additional plans.
Well, I think it's important, you know, because all of us, we tend to very much depend on the advice of our friends and our peers. But in reality, from what you've explained to me, what might be the best plan for you is not the best plan for me. So we need to.
Correct.
They need to be careful and make sure they're basing that plan on their health and their medications. Would you agree with that?
Absolutely, and I think it's good to say a case by case. So what works for your neighbor doesn't necessarily work for you. You're not maybe seeing the same doctor. You're not taking the same medication, and that would be a recipe for disaster if you were just going along with the neighbor because it worked for them.
Right. Lots of choices out there. And we've got the Medicare phone number up there, and we appreciate you being here today.
Well, thank you so much, Jeff. I enjoyed it.
Well, thank you very much. We'll be right back with more Coming of Age and a conversation with geriatrician Dr. Johanna Giordano about Alzheimer's disease.